Hello, Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. How are you on this Saturday evening? Hoping that you're having a great start to the weekend. Hoping you're keeping yourself warm as well, because we are in those winter months and we're going to have a bit of rain across the country as well. So today we're going to talk about a topic that we think is very, very informative for everyone. And we're going to talk about obesity and how obesity is not healthy. Now, as is in many health issues, it's the awareness that matters. It's the awareness that starts with making a person mindful of the issues that we have in front of us. And of course, as we talk about, prevention is better than cure, that's what we want to do in today's program. We're very happy to have with us in the studios Dr. Vikas Aziz, who's a bariatric surgeon. Thank you very much, Dr. Vikas, for joining us.
Thank you very much for calling me in your show.
Likewise. Okay, now when we talk about your specialties, you're a bariatric surgeon. What exactly does a bariatric surgeon do?
Bariatric surgeon reduces the size of the stomach in order to limit the food intake that would lead to a weight loss.
Okay.
So we play with the stomach and the intestines.
Right.
So to limit the size and to bypasses.
Okay, and so a bariatric surgeon and a laparoscopic surgeon?
Yeah.
It's the same thing. Okay, right. So what are the different types of bariatric surgery then that are
mainly
available?
there are two types of surgeries, the restrictive ones and the malabsorptive ones, and sometimes they're both are added together.
Right.
In restrictive type of surgery, we make a small pouch of the stomach, and that's how the patient gets to eat less amount of food.
Okay.
In turn, they get less calories, and the fat is burned to gain energy. So
Right.
that's why they reduce their weight.
Right.
And
okay.
the other one is the malabsorptive. We bypass the stomach, so the food directly goes into the intestine. That's why it gets less absorbed. So
Right.
that would also lead to weight loss.
The weight loss, okay,
Yeah.
and that is the gastric bypass as it's known. Okay, so now as we're talking about obesity, for those people who don't know, how is somebody categorized as being obese?
If we put it in simple words, then the excess fat deposition in the body is called obesity. But according to World Health Organization, there is a classification based on the BMI, which is the body mass index. It is a ratio of the height and weight of the patient, and they have categorized into BMI 30 plus is obesity.
Right.
So the normal BMI is 18.5 to 24.9.
18.5 to
24.9.
24.9. That is the normal BMI.
And below 18.5, it is underweight.
Underweight.
Yeah. And above 25 to 30,
Excuse me.
it is overweight.
Okay.
Yeah.
So not just obesity as well, being underweight is also an issue too.
Yeah.
Right. What are the issues, health complications with being underweight?
Due to underweight, there would be less immunity, then they would get disease frequently. So they have to have a balanced diet with that to achieve that correct BMI.
All right, okay. So when we talk about reasons for becoming obese, and we also see that this is something that is gaining alarming statistics all around the world and in Pakistan, because before we were going to record as well, when we were having our chat, you were telling me about where Pakistan is ranked as being one of the most obese countries. Where are we?
Yeah, we are on the 9th level in
That's
the most
alarming.
obese countries. And in 90s, there were about 1% of the population was in the overweight and obese category.
In the 90s?
In the 90s.
Just 1%?
Yeah. And now it has gone up to 10.3%.
Right.
And
okay.
33% of our women are in the obese category.
33% of our women are in the obese category. I mean, that's something that is alarming because, as we said, it's so easy to let the weight creep up and not realize actually that what is happening, it's gradual. For many people, it's just a gradual process where they've just, they're not watching their weight. So they're not aware of how much they're gaining. Right. So as you said, that we are gaining percentage in being in obesity.
Yeah.
So what are the reasons for it?
The basic reasons for being obese is that we are not consuming a healthy, balanced diet. So there is lack of sleep, and there is increased sedentary lifestyles. We are not going to the gyms, we are not going to the parks for jogging, walking, running. We are not doing any activities, and our screen time is increased. We are watching television, we are doing work on our laptops, we are using our mobiles, and that leads to sedentary lifestyles.
Right,
So
okay.
another factor is old age. In
Old
old
age.
age, the
Metabolism reduces.
metabolic rate is reduced. That's why they tend to gain more weight. And pregnancy is another cause for gaining weight.
Right, okay.
Yeah.
As you mentioned that around 30-33% of women are obese in Pakistan. So many women argue that we're very busy with the housework and we're doing a lot at home. Does that constitute towards exercise or burning calories?
No, that you have to take out time to do some exercise.
Right.
I would suggest they should take 20 to 30 minutes a day for these. We should be particular for exercise. The house chores, they don't come into that category.
Right, okay, so that's another myth busted, unfortunately, for all the ladies who are, working a lot at home. Unfortunately, that does not add up to, an exercise for weight loss. You may be active, which is a good thing, but it's not going to help you burn calories. For that, Dr. Vikas is saying that at least 30 minutes a day of exercise.
Yeah.
Okay, if you can't go to the gym, let's just say you can't go to the gym, you don't have a place near you to walk, a park or wherever.
Yeah.
What can you do at home?
You can do simple exercises. You can do aerobics at home. You can take a stroll down the street.
Right.
So you just have to spare some time for yourself.
The main thing is getting some cardio and keeping
Yes.
that up and having something that is consistent.
Yeah.
So basically, no excuses. If you've got to dedicate that 30 minutes a day for yourself. I mean, because I think, women in our part of the country, they unfortunately tend to keep themselves at a lower priority.
Yeah.
They'll worry more about their husband and the children and the house and everything else being in order. But when it comes to themselves, they're a bit, not giving themselves the importance.
One thing
due.
I want to add, the women which are getting obese, they usually have to finish the food of their children. So they're
that's so
yeah,
true.
they're eating more, so they have to control their portions. So that's why this is one reason they're gaining weight.
That's absolutely true. I mean, you have actually, I think, pinpointed
Yeah.
one of the main things, because many mothers will do that.
Yeah.
When it's, they've seen that their children have not finished their food and they don't want to waste it.
Yeah, yeah.
So
Yeah.
with the intention of not having it
Yeah.
to waste, they'll eat it, and that's piling on the calories.
Yeah.
Exactly.
So if a person needs 1,800 calories a day, they're consuming about 2,500 to 3,000 calories a day.
Yeah.
So all the calories, excess calorie, would be converted into fat, and they would gain weight, and the BMI would surge up.
Right, okay. Now, you mentioned lack of sleep as well.
Yeah.
That's something that many people do not associate with the weight gain.
Yeah.
What happens when we're not getting enough sleep?
We have to have 7 to 8 hours sleep. So if there is a lack of sleep, there would be imbalance of hormones, and due to those hormones, there would be ready to take high rich diets, like they would be consuming carbohydrates that would lead to weight gain. Yeah.
Okay, right. The diet. Now, let's talk about that. In many houses, we still have, the breakfast of parathe and fried stuff or fried eggs or nihari or whatever. Tell us what that's doing to our system as well.
If you are taking too much fat and you're consuming too much carbohydrate, these are high caloric diets. So in turn, you would gain weight. So they're not healthy. You have to have a balanced diet. It should include lean protein. You should take fruits and vegetables that would give you certain minerals, vitamins that are healthy for your life.
Childhood obesity, because we're seeing a lot of that as well.
Yeah.
Unfortunately, a lot of that is also cultural, because when, you know, little children, infants, we seem to have this sort of desire to see them sort of chubby, you know, and otherwise we think, you know, the child is, the baby's weak. So, you know, this thing as well, kamzor ho gaya, bacha kamzor ho gaya, and that thing as well, how do we tackle that?
We have to take consideration the diet. It's most important. You don't have to overfeed the children. You have to cut the junk food, the potato chips and these kind of things. They're adding carbs to their diet. So that's why they're gaining weight, and that's not healthy. And that would lead to diabetes, hypertension, sleep apnea, and stuff like that, which are related to obesity.
Right.
Yeah.
So mothers who are overfeeding their children, what advice do you have for them? What should they be doing?
They should retain the portions. They should give them smaller portions, and they should avoid the junk foods. They should give them fruits, vegetables, and healthy items. They should limit their screen time. They shouldn't be getting these PCs or iPads, like things like that, for too much time. That should be less than 2 hours. And they should go to the parks. They should have some activity. They should play.
Absolutely, they should be encouraged to, you know, to have movement and play. That's what kids are designed for. I mean, because in your childhood, one of the major things that you enjoy is the playtime. Right. Okay. We spoke about risk factors as well. Can you please tell us about those?
The risk factors, there are mainly 3 risk factors. One is the behavior of the person, and the genetics, the environmental factors, the psychological factors. They play an important role. Right.
The genetic is, you know, if you're predisposed to...
Yeah, it's a built-in mechanism. The patients who are genetically built like that, they tend to gain more weight in spite of eating less.
Right.
Yeah.
What do they have to do then?
They have to do consistent exercises. They have to follow a certain plan, a diet plan.
And be very careful of what they're eating.
Yeah.
Okay. The environmental. What's that?
Basically, it's the environment and the surroundings which we are living in, like how we behave at schools, at our community, how we eat, what are our eating habits, what sort of food we are consuming. That plays an important role.
And also, I suppose, you know, it does make a difference that if everybody around you is, you know, much more slimmer, then that makes you mindful of the fact that, you know, you've also got to sort of, you know, maybe you're not the norm right there.
In our region, we are consuming too much carbohydrate. The rice and the chapatis, they're full of carbohydrate. So we have to cut that down. And have to consume more fruits and vegetables and fluids.
Right. Okay. So when you're talking about vegetables, we also have this sort of an unhealthy way of preparing the vegetables, where we'll have a lot of oil in them. So that we have to be mindful of that too.
In our part of the world, we tend to overcook the vegetables. So we are destroying all the vitamins and the minerals. So we have to be careful, don't overcook the vegetables.
Right, okay. And I think that is something that, you know, the ladies who are at home and who are cooking, they would sort of, that's very important too. Dr. Vikas is saying that we tend to overcook the vegetables and we tend to put in a bit of too much of oil. And that is something that, you know, we need to stop doing, because that is definitely unhealthy and definitely adding to problems. And we'll come back to the topic. Right now we're going for a break. Stay with us. Welcome back to the program. We're talking about obesity and the health complications that can follow if you are obese or if anyone in the family or your loved ones are obese. Dr. Vikas, we were also talking about the psychological element in being a risk factor for obesity. Tell us about that.
Mainly the patient who have depression and their own antidepressants, they tend to gain weight. In depressive illness, some patients, they tend to overeat. So that's a reason for gaining weight.
Right.
And some drugs, they do also play an important role in gaining weight.
Right, okay.
Yeah.
As you said, in depression, sometimes people turn to food as comfort eating as well. Again, that would have to be then the patient being mindful, because it becomes a vicious circle, does it not? The depression, then the eating too much, so then you'll be gaining weight, and then the side effects of the medicines as well, so that's all coming together. Yeah. So in that sort of, it would be a good idea for a person to have maybe a change in routine, a walk outside too.
The main thing is psychological support.
Right.
It would be seen by a psychologist who is trained well enough to deal with these kind of things. They have to have some support groups so they can identify the trigger points which are leading to overeating.
Okay, now seeing a psychologist, a very, very important thing that you have just mentioned. Unfortunately, in our part of the world, it's still seen as a sort of a stigma or a sort of a taboo or a sort of a, you reach a wall when you ask someone to see a psychologist. How can we tell people that it's okay? I mean, your brain, your mind is such an important part of your being.
Yeah, we have to counsel the patient. In our obesity clinic, we have a whole team which is involving a bariatric surgeon, a psychologist who is keen in dealing with the eating disorders, and a dietitian. So we all help the patient in developing a certain plan. Which is effective.
Okay, so that is really important. The psychological, the part of counselling, we sometimes don't give it as much importance as we should. It's a very, very essential part. As Dr. Vikas is saying, in the clinic they have a network of different people of expertise, a psychologist as well, who will be counselling you. And in fact, one of the most important things is to have that support, that emotional support that will help you.
Behavior modification is the essential thing in bariatric surgery.
Behavior modification.
If you're not ready to change your habits, then the surgery won't help you.
That is a very important point, exactly. If you are, until you help yourself, there's a limit to what other people can do for you. Surgery is only 20% part of the whole management. Okay.
The patient has to be psychologically sound to understand the pros and cons of surgery.
What are some of the challenges when you talk about behavior modification?
Some patients, they are on drug addictions, alcohol addictions. So if they don't leave that addiction, they won't get help with the surgery. They won't get weight loss.
And also, I should think that it would be the family as well coming together and offering that support, as you were mentioning, the support groups as well. Okay. What diseases cause obesity?
There are certain diseases which are caused by the obesity, that like it's type 2 diabetes, high blood pressure, heart diseases, sleep apnea, infertility, and arthritis, low backache. These all are related to being obese.
And is it sort of a two-way relationship, that the obesity can cause these diseases and these diseases can make you obese as well? Is that
like if the patient is having arthritis, is painful knees, they won't get mobilized enough. So over a period of time, they would gain weight. So if we have to limit their disease, we have to keep their weight down.
Okay. Another very important point that was discussed about before as well was that malnutrition can also lead to obesity, which is not something that you would actually connect. You wouldn't connect the dots that way. How does that happen?
Malnutrition is basically you're not getting enough proteins and you're consuming more carbs and fats.
Okay.
So in turn, these are all converted into fats. There is more deposition of fat in the body, so they would get obese. So they have to have a balanced diet, which includes a small amount of carbs, fat, and more lean proteins, vitamins, minerals, and more fluids.
Right, okay. And is it possible for somebody to look okay? You know, when you see them, they seem that they're okay in proportion, but they actually may be obese.
Yeah, they, to see that thing, we have to measure their BMIs.
Right.
Sometimes the patient has more height and they don't seem heavy. So we have to have a BMI. When we calculate their BMIs, there's, that lies in that category.
Right, okay.
Yeah.
So what happens when a patient comes into your obesity clinic? How are they evaluated?
First of all, we take a history. We talk to them about their eating habits, their daily exercise plans, or their mobility, how they live, how they work. So after that, we tend to do some lab investigations. We have to see their vitamin levels, their hemoglobin, and things like that. And then we have to assess them accordingly. Yeah.
Okay. You mentioned infertility. Please tell our viewers who are watching right now about infertility and obesity and the relationship between the two.
Due to obesity, there is imbalance of reproductive hormones, so that would lead to infertility. As the patient loses weight, their hormone balance is corrected and they gain fertility.
That's how important it is. So, basically it seems that everything is coming down to the same denominator, which is that if you lower your weight, you are going to be, you're going to be less prone to having diabetes and all the diseases that Dr. Vikas mentioned. And also, if you're trying for a baby and you are finding it hard to conceive and your weight is a problem, so if you lose that weight, that will make you more likely to conceive.
But I have to add one point over here. After bariatric surgery, you don't have to have pregnancy for 2 years.
Okay.
Because you won't lose enough weight till that moment. And if you get pregnant after the surgery, and again you'll gain weight.
Okay, so after bariatric surgery, 2 years, you should not have a pregnancy. Okay, right. So now that somebody is diagnosed as being obese, what happens then?
If the patient, there are 2 indications for bariatric surgery. Mainly if the BMI is 40 plus, and they're a candidate for surgery. Okay. And if their BMI is 35 and they have got obesity-related diseases like diabetes, hypertension, and other diseases, so they're candidate too.
Okay. What are the categories of obese? I mean, mildly obese?
That is also based on the BMI.
Right. So what are those categories?
Yeah, the class 1 obesity, it's from 30 to 34.9.
Okay.
And class 2 is 35 to 40, and class 3 is 40 plus.
40 plus.
Yeah.
And that is the morbid obese?
That is morbid obesity is called when they have got these obesity-related diseases with that. Yeah.
Right, okay. What treatment is then provided? What is available, of course, depending on, how far along a person is in their problem?
When a patient comes to us in our clinic, we have 3 types of treatments. First is the behavior modification, and the diet control. The second is the medical management, and third is the surgery. In behavior modification, we have talked about that. We have to cut down the portions. We have to take vegetables and fruits and things like that. They have to follow a strict structured exercise regime, and they have to follow a diet plan for 6 months. So we have to see that if the patient is willing to lose weight. So if he's not willing to lose weight, then we won't offer him surgery.
Okay,
Yeah,
that's
yeah,
another
yeah.
sort of a right. So that people, instead of coming in and opting for the surgery straight away, they have
Yeah.
to be told that no, first we want you to show us that you are
Yeah.
capable of losing some
Yeah,
weight.
yeah.
Okay.
And with this behavior modification, the patient just loses 5% of their excess weight.
Okay, just
Yeah.
5%.
Yeah, just
Then-
5%. And if they stop that, they would regain the weight.
Right, okay.
And second comes the medical management. There are certain drugs which limit, they suppress the appetite.
Okay.
Or they.
What drugs are those?
These are orlistat. These are drugs that help in. They help in getting the fat. It doesn't absorb through the intestine. So
Okay.
that's why they lose weight, and that too, about 7 to 10% excess weight loss is.
Okay. Are those sort of drugs suitable for...
They are not suitable for long term. They have certain unpleasant
Side
side effects, like the patient may have fat stools. They have urgency after stool, excessive gas production. So
Okay.
that is a bit nuisance.
Right,
Yeah.
okay. What else are they advised patients?
Third comes the surgery.
The surgery, that's the last.
That's the last
resort.
And
Okay.
the excess weight loss is about 50 to 85% after the
50
surgery.
to 85%.
Yeah.
Okay. Tell us about surgery itself, what it involves.
Before embarking on the surgery, we have to put the patient on a strict low-carb, high-protein diet.
For how long?
For 2 weeks, 2 to 3 weeks. That would
Okay.
help in reducing some weight, and it shrinks the liver as well. So that would be very helpful for the surgeon who is operating.
Okay.
Yeah.
Right. And
After 2 weeks of strict diet, they undergo the surgery. So it depends upon the BMI. We have to discuss with the patient what he wants and what the surgeon wants. So it's a mutual understanding by the patient and the surgeon.
okay.
So after the surgery, it's about 45 minutes to 1 hour surgery. The patient is kept for 2 days in the hospital, and it's a laparoscopic surgery, minimally invasive. We make 5 holes in the tummy, and we do the surgery. And after 6 hours of surgery, the patient is mobilized. He can walk. He can go to the bathroom with some help.
Right.
So for the 2 weeks after surgery, they are put on a liquid diet. Yeah,
Okay.
it's a high protein liquid diet.
Okay.
So that
They're not eating solid food yet.
Yeah, no. So we have divided the stomach, so they need some time for the healing.
Okay.
Yeah.
Right. So tell us about the advancement that laparoscopic surgery has made for surgical procedures and for patients as well.
The bariatric surgery is not a newer thing. It was started in the 50s, but the people were doing it openly.
Okay.
So in 1970 probably that they turned doing these laparoscopic surgeries. In the late 80s, they were doing these laparoscopic surgery. So that has made a huge difference because due to these laparoscopic surgeries, they don't have large wounds, and they don't have that much pain, and they can easily mobilize. They can do their work at home after 1 or 2 days of surgery.
Have you ever had patients that you'd had to refuse for bariatric surgery because of one reason or the other?
Yeah, the patients who are drug addicts,
Okay.
or they are not willing to undergo these kind of behavior modification. They are psychologically challenged, and they don't understand the pros and cons of the surgery, and so that's why these are the contraindications.
Okay. We spoke about childhood obesity and the impact of culture as well. How is childhood obesity then, a child who comes to your clinic, how do you deal with the children?
So right now we're doing surgery on 16 to 60 years of age.
Okay.
We're not dealing with the childhood obesity as such. So, but we have dietitians who can help them with those obesity-related issues.
Okay. You spoke about eating disorders as well, being quite, a common predicament as well. What different types of eating disorders are there at the global level and then in Pakistan?
Some people, they have binge eating, they have bulimias, different kind of diseases, but that is the domain of the psychologist or the nutritionist. I'm involved with the surgery, so we have a team. That's why they treat these kind of things, and if they are treated, then they send us these patients.
Right,
Yeah.
right. Another predicament when we talk about food, because it all starts from there, from our diet. Many people say that if we're not going to eat rice or we're not going to eat roti, then what are we supposed to eat?
We are not saying that you should stop everything, but
Okay.
it should be a balanced diet. If you're
Right.
having roti, it should be a smaller size. You should have it at dinner time.
Right.
You can have some fruits in the evening. You can have nuts. You can have
Fiber.
yeah, fiber. You can have lean protein. You can consume fish and chicken. So,
Okay.
yeah.
How bad is rice for you, and how should you limit rice? How do you know how much you can eat?
Rice is basically a carbohydrate. So if you're consuming more carbohydrate, then naturally you would gain weight. So excess of everything is dangerous. You have to limit your portions. You can have rice, but not in a big portion. In a smaller portion, say it's a half cup.
Half a cup.
Yeah,
Okay.
at one time. Yeah.
Right, at one time.
Yeah.
Right, okay. As we're talking about obesity and the health implications that it has, and you also mentioned that with age your metabolism, of course, gets slower.
Yeah.
What is the relationship between obesity and metabolic syndrome then?
Metabolic syndrome is related to obesity because there is imbalance of hormones. So with obesity, the hormones, there is increase in certain hormones that lead to weight gain. So we have to limit their weight. So when the weight comes down, the metabolic syndrome gets treated by itself. So like the patients, they are having insulin, these type 2 diabetes, they get treated with these weight loss surgeries. About 90 to 95% of the patients, they go into remission. They are treated with diabetes. They don't need any oral hypoglycemic agents, nor they need
just
any
by
insulin.
lowering the weight.
Yeah.
Okay. We spoke about the surgery, and what about the post-operative care and the patient themselves? What do they need to be careful of, and how do they change their lifestyles after having surgery?
After having surgery, for the 2 weeks post-surgery, they are strictly put on liquid diet. After 2 weeks, they are allowed to have soft diet. And on the longer run, they need to control their portions. They have to eat less food. They have to chew it properly and then swallow it. So if they gulp the food, that won't help.
That's also a very important point, to chew your food. We see usually, when we're eating, we're not really being mindful of what we're eating. We may be doing something else, maybe looking at our phone, maybe watching television, maybe talking to somebody else. And that also is important, is it? To take your time to eat.
Yes. When you're eating, you should concentrate on eating.
Right,
Yeah.
right. Okay, unfortunately we've come to the end of today's program. It's been wonderful speaking to you, Dr. Vikas, and a lot of information for our viewers regarding obesity. Any short message that you have for the viewers who are watching today?
I would like to say that you should have a healthy lifestyle, eat lean meat, you should have fruits and vegetables, and have a proper exercise plan. Thank you.
Wonderful. Thank you very much. Okay, so we've come to the end of today's program, a very, very important topic, obesity. And as we say, you know, prevention is better than cure. So make sure you are mindful of how you're leading your life. So until next week, stay happy, stay healthy. Bye-bye.